Esophagus is a long muscular tube that extends from the posterior part of the oral cavity to the stomach. It consists of three parts: the cervical part, the thoracic part, and the abdominal part of the esophagus. The nerve supply of the esophagus is divided into two components. Number one is the parasympathetic component. The second is sympathetic component. The parasympathetic supply comes from the cranial nerve. Then they divide into two branches, the right vagus nerve and the left vagus nerve. These both supply the right and left side of the cervical part of the esophagus. These two nerves combine together and merge in the thoracic region to form the esophageal plexus that provide the nerve supply to the thoracic part of the esophagus. As they pass down the diaphragm to the esophageal opening, these plexus again convert into two branches, anterior and posterior vagal trunk, that supplies the abdominal part of the esophagus anteriorly and posteriorly. The sympathetic nervous system consists of the sympathetic trunks, the cervical and thoracic, that are formed by the collection of the ganglions present in the cervical and thoracic region. In order to understand the sympathetic trunks, we need to look at these diagrams. Sympathetic trunks are basically a collection of the ganglia that are present on both sides of the spinal cord. These are cervical ganglia, thoracic ganglia, lumbar, sacral, and coccygeal or ganglion impar. There are 3 pairs of cervical ganglia on both sides of the spinal cord, 12 pairs of thoracic ganglia, 4 pairs of lumbar, and 4 pairs of sacral, and 1 coccygeal ganglion. Only thoracic region of the spinal cord is able to send the preganglionic fibers. These fibers come from the spinal cord and either ascend towards the cervical ganglia or towards the lumbar and sacral ganglia, or either they move straight towards the thoracic ganglia. In these ganglia, these fibers synapse and send the postganglionic fibers towards the viscera in order to innervate them. So here we have the cervical sympathetic trunk that comprises of the 3 ganglions. Superior cervical ganglion that is present in front of C1 to C4 vertebra, the middle cervical ganglion that is present in front of C5 and C6, and the inferior cervical ganglion that is present in front of C7 and C8 vertebrae. So these cervical sympathetic ganglions receive the preganglionic fibers from the thoracic region, from T1 to T4. As we have previously discussed, that the fibers from the cell bodies of the neurons of thoracic spinal cord send the preganglionic fiber that can either ascend upward into the cervical ganglions and downward towards the lumbar and sacral ganglions. So here T1 and T4 level of the thoracic spinal cord are sending the fibers that are sending upwards and forming the cervical sympathetic trunk that supply the cervical part of the esophagus. The thoracic part of the esophagus is supplied by the thoracic sympathetic trunk that is formed by thoracic ganglions, and the abdominal part of the esophagus is supplied by thoracic spinal nerve that is formed by the fibers from T5 to T12. Thank you so much for watching this video. Do not forget to like and subscribe. If you want us to review the anatomy of any organ or viscera, comment down in the comment section. Thank you for your support.